Patient Inquiry is a web-based software that determines very efficiently 3 primary scores for your patient: the initial functional status measure, the predicted change in functional status measure, and the actual change in functional status measure. When you understand these 3 main measures and how they work together, you will begin to discover the power and value of the patient inquiry system to your outpatient rehabilitation practice. At admission, we ask your patient to complete a short survey about the functional level of the body part or impairment that needs treatment. From these answers, we calculate his functional status measure. This measure is a score, usually on a scale of 0 to 100, that represents the functional ability. For example, if your patient's functional status measure for his knee injury is 20, we might say he has only 20% of the ability that the perfectly healthy knee should have. During his survey at admission, we also ask your patient a few risk adjustment questions. Questions about age, acuity, severity, comorbidities, etc. form risk factors we employ to calculate a predicted change in functional status, or a predicted outcome, just after your patient completes his survey. The predicted outcome is the average amount of change in function similar patients in our database have achieved after treatment at discharge. Our extraordinarily large database enables us to identify large sets of patients with identical risk-adjusted profiles to your patient. Typically, we ask your patient to complete a survey once every 4 or 5 visits and at discharge to track the improvement of functional ability during treatment. Your patient's actual change in functional status measure or actual outcome measure is determined by simply subtracting the score at admission from the score at discharge, or the latest score. This outcome score represents the improvement or change in function during treatment. Why is collecting outcomes so powerful and valuable? That's what we'll learn next.